Hi students, today's lesson is Recent Trends in Counseling. This lesson is about the concept of recent trends in counseling. The major purpose of this presentation is to introduce the concept of recent trends in counseling. Top trends in counseling include healthy job growth, technological advancements, and greater sensitivity to diversity issues. Careers in the field of counseling exist in a multitude of settings, including hospitals, psychiatric centers, universities, colleges, schools, career counseling centers, family counseling centers, industries, and private clinics. On the completion of this lesson, you should be able to 1. Examine the recent trends in counseling. 2. Discuss the future challenges of counseling. The job outlook in counseling field is expected to be faster than average. Population growth will increase the number of students in schools and universities, generating greater opportunities for school and career counselors. According to the Bureau of Labor Statistics, school and career counselors can expect 19% in employment growth from 2010 to 2020. Additionally, times are changing and drug offenders are increasingly being sent to treatment programs rather than jail, increasing the need for counselors. Substance abuse and behavioral counselors can expect better than average job growth with projections of 27% growth between 2010 and 2020. Technological advances are giving counselors new tools for reaching clients. A counselor and client can communicate via email or video chat. Online discussion forums and chat rooms allow counselors to reach large groups of people. Counselors publish helpful articles online for the masses to access at all hours. Search engines assist clients to identify and contact the right practitioners. Advances in technology have also made it convenient for aspiring counseling psychologists to obtain and advance their degrees in an accredited online program. Also, with the availability of online professional journals and other online publications, counseling students and professionals have access to the latest research in the field. Online professional networks also make it easy for counselors to confer with their colleagues and advance their professional development opportunities. Diversity and sensitivity. Increased sensitivity to people of various backgrounds is another significant trend in this field. Diversity of culture, religious or spiritual orientation, gender identity, and physical disabilities are some of the issues that require knowledge and in-depth understanding. Students of counseling psychology programs receive important training on how to work with and demonstrate sensitivity towards clients from diverse backgrounds. The services of counselors are vital and in high demand these days. With number of job opportunities, technological tools, and diversity in training, students who enroll in an online program in the field of counseling can expect a fulfilling career in the years ahead. In 21st century, the counseling profession is impacted by globalization and technology. In the late 1980s and early 1990s, counseling extended to various new directions. Outreach services for the poor and homeless. Outplacement services for middle-aged workers and senior executives. Prevention and early intervention programs for alcohol and drug abusers. Emerging concerns with retirees. Stress management. Sports and leisure counseling. Multicultural counseling. Globalization and technology. Counseling as a profession has gained importance in the society, helping individuals solve their problems. Counseling as a profession has witnessed a lot of changes as well as challenges. The future challenges are not only remedial, but preventive efforts are considered more important. People still face significant societal problems that affect millions of citizens. There is a realization that only treatment cannot solve societal problems. Only prevention has the prospect for diminishing the number of potential victims of nearly all those socially ill. New trends evolve according to the needs of the society. According to the rapidly changing societies, they need to be adopted for counseling to remain the helping profession. Ever increasing AIDS epidemic, the continuing addiction of millions to drugs and alcohol, the alarming number of abused children and spouse, gender issues affecting women in particular, vulnerability of the transgender community, suicides, criminal activities among teenagers, the persistent school dropouts, the disgraceful number of homeless, the resurfacing of various forms of prejudice, a bankruptcy of values in all areas ranging from the political to the private sector, the emergence of counseling psychology as a distinct profession in the United Kingdom 2 decades ago was a significant pointer that the field's practitioners, represented by the British Psychological Society, had finally recognized that the field is unique in terms of identity and practicing philosophy. This recognition is captured in the definition by the society that counseling psychology is a value-based approach to counseling as a profession and puts emphasis on the counseling primacy or relationship-oriented approach based on therapeutic observation. However, amidst the recognition are challenges, both present and potential, affects and will continue to challenge the effectiveness of counseling psychology as a noble profession. The challenges, as a matter of fact, are based on the models of delivery of counseling psychology. Presently, scholars and practitioners have identified issues such as technological revolution challenges, ethical dilemmas in relation to health maintenance organizations, psychologists facing certain challenges including prescription delivery services and challenges with empirical research-based support system, among many other issues. Although these issues are no doubt a big concern currently, the biggest debate has revolved around the role of technology in counseling psychology. Considering that the literature about this area is hard to come by, the growing dilemmas are based on the impact of technology on the growth of counseling psychology and at the same time the challenges that come with its increased use given the nature of counseling psychology services modes. Internet counseling technology has become part of almost every household and is predicted to continue having tremendous impact on the lives of families and households, particularly in the spheres of economic, socio-political and cultural aspects. In fact, internet technology has not only affected how families and households buy or sell things online through e-commerce trading platforms, but has also had a tremendous impact on physical and mental health of many people around the world. Health professional practitioners have therefore incorporated internet into one of their modes of transferring services to the care receivers or clients. In turn, the general public, including those in need of counseling services, can access these services from home within minutes and cost effectively. However, the inherent challenges when delivering counseling services via internet cannot be assumed and has attracted unending debate not only on its viability but also its effectiveness as compared to the traditional in-person mode of counseling. The question would therefore be on whether advantages of internet counseling supersede its disadvantages. The British Psychological Society established a division of counseling psychology professional practice guidelines in 2006, which emphasized the need to have a balanced approach to counseling psychology service delivery methods. For instance, they state that the practitioners should not assume any form of automatic superiority over anyone in terms of experience, feeling, value, and know-how. They also state that any practitioners should be ready to challenge the views of persons who pathologize on the basis of sexual orientation, disability, class origin, or racial identity, religious and spiritual views, among other critical aspects of the society. The concept of not assuming one-way knowledge in counseling psychology has led to a number of challenges, particularly with the increasingly growing technology-laden population, including those in need of counseling and psychological support. In certain cases, the client may not have the adequate mental capacity to interpret certain information, thus leading to miscommunication. In other words, the client may wrongly interpret a message as critical or not friendly, thus end up feeling hurt or injured. After all, online interaction sessions do provide neither counseling psychologist nor client with shared environment. Internet psychotherapy sessions may suffer from miscommunication between the psychotherapist and client. In any case, studies have shown that miscommunication may inadvertently harm the client and possibly increase trauma after the disclosure of important facts about them. For example, text or email based communication is prone to miscommunication since the more important non-verbal cues are missing. Moreover, most counseling psychologists are mainly trained on in-person techniques. The counseling psychologist may thus lack the writing skills necessary to adequately express meanings in written words. As technology pushes people to the brink of being an entirely online society, the viability of internet counseling will remain a thorny issue, as it is apparent that certain aspects of counseling psychology could be more difficult to deal with than others. Most professional organizations unanimously recommend that counseling therapists practicing online counseling sessions should continue using the basic ethical standards applied in the in-person psychotherapy sessions. Some of the recommendations are based on the need to adhere to the informed consent used in in-person counseling, including informing the clients about risks, benefits, available safeguards, limitations and exceptions to confidentiality and privacy, identity verification, limiting practice to the scope of one's qualification, accurately representing themselves and their licensure status, finding solutions to the potential harm that may arise from dual roles, and establishing emergency response for clients in different geographical locations. However, the question that has never been answered is how to deal with clients coming from different jurisdiction locations with varied laws and legal procedures. In addition, a therapist may find it extremely difficult to handle a case where a client threatens to commit suicide. The introduction of diverse digital versions in the counseling psychology practice has brought with it diverse problems related to informed consent, disclosure, and confidentiality. However, like any other internet usage, the concept of informed consent, disclosure, and confidentiality still launches as serious sources of dilemma. The lack of physical presence may make it difficult to verify identity, thus may lead to psychotherapists treating a minor without parental knowledge and this consent. When such occurrence become rampant, there is likely to be more actions from policymakers to protect the majority from the possible breach of informed consent in the context of internet counseling. Within the context of informed consent is the issue of confidentiality, a critical aspect of counseling psychology. Studies have shown that internet is not a secure platform to assure the preservation of confidentiality. Although psychotherapists are advised to inform the clients of the potential dangers and risks associated with modes of service delivery, including breach of confidentiality and experimental nature of the process, this kind of advice still leaves gaps in better ways in which confidentiality can be maintained, a concern that is unlikely to end anytime soon. Accuracy in assessment and monitoring. Effectiveness of interventions. One of the first steps in the counseling process is to assess and monitor the client. However, with barriers in the virtual world, it may be difficult to accurately assess and monitor the patients during service delivery sessions. It is important to note that virtual interaction means lost contact, which is an integral part of achieving the goals of counseling psychology as outlined by the British Psychological Society. Moreover, one of the perspectives that were present during the formative periods of counseling psychology is the need for psychologists to understand people as relational beings. In the process of fostering collaborations with people as well as contexts that draw on a range of perspectives, including the traditional views of people as independent entities, counseling psychology has always recognized that relational perspectives have significant contribution to make on not only understanding people but also help the clients work towards bettering their well-being. However, this relationship is lost through lack of physical interaction between the psychologist and the client. Moreover, the psychologist's inability to focus on other family members and intimate partners obviously jeopardizes any chance of learning the relationship between the clients and their significant others. As Barnett states, failure to understand the relationship between clients and people close to them may make it difficult to assess the former's self-esteem, likes, cultural upbringing, and socio-political background. The controversy that is likely to extend over a long period of time is the criteria in which internet psychotherapy sessions can be evaluated. While the traditional in-person counseling therapy has elaborate theoretical frameworks and models that support its use, internet counseling psychotherapy does not have any historical frameworks and models that guide its use. Although most psychotherapists have solely relied on relational counseling, they still run short because of the inability to establish therapeutic relationships with clients. At present, the main concern is how the traditional models can be interpreted into online models. Barak et al. Observed that internet-based interventions in the field of counseling psychology have been used for over a decade. However, no clear analysis of its effectiveness have been forthcoming. They, however, recommend adoption of online counseling as a legitimate option in offering psychotherapeutic counseling sessions. Still, they warn that the psychotherapist must be willing to use online counseling with strong ethical issues in mind. Ethical challenges. The other challenge is the ethical issues that emerge from counseling psychology practice. In the field of practice of counseling psychology, one of the potential current issues is how to enforce ethical code of conduct, including ensuring psychologists only practice within their areas of competence based on qualifications in terms of training as well as experience. In addition, the psychologists are expected to take reasonable steps in ensuring their work, follow necessary procedures that protect clients from any possible harm. However, this challenge still poses serious challenges to the regulatory authorities as it is difficult to weed out unqualified persons from assuming counseling responsibilities at the detriment of the clients. In essence, professional accountability is still considered far from being managed. Furthermore, laws governing counseling psychology practices may be different from one geographical jurisdiction to another, with questions as to how the two persons, client and psychologist, can operate. It has been observed that many practicing counseling psychologists have attempted to navigate through the legal and professional barriers in internet counseling by defining their online counseling services as psychoeducation. Although some online counseling may be legitimately offering pure therapeutic education services, some therapists cross the boundary and treat clients within multiple sessions, which clearly suggests therapeutic counseling sessions rather than claimed educational. This is a serious ethical breach that, although may be tamed by stricter regulatory laws and policies, may be difficult to interpret for appropriate actions to be taken. Online counseling in the field of mental health. Imagine a future where most counselors text their clients or video chat with them. Then picture these counselors working alongside doctors, yet focusing more on the strength of their relationships with clients rather than symptom reduction. Yes, online counseling is becoming popular in some countries and proves to be a tool to the clients who could save time, energy, and money. It's not as far away as you might think, and it's only scratching the surface of how counseling profession is changing with the changing times. Counseling will always have the mission of helping people live a happier and healthier life. But the methods of working with and reaching clients are evolving rapidly in recent times with the advancement of technology. To glean a glimpse of this future, keep reading to learn about the most prevalent current and emerging counseling trends we looked into. Online counseling. Texting, voice messaging, and video chatting with counselors. Roughly 1 in 5 adults in our society experience mental illness every year. Approximately 60% of them do not receive treatment because of the stigma, costs, inconvenience, and inaccessibility of mental health services such as counseling. Online counseling is an effort to make seeing a counselor more affordable, convenient, and stigma-free. It uses technology such as secure text, audio, and video messaging to facilitate sessions and conversations between clients and licensed counselors. This helps clients who do not have enough income to pay huge per session or the time to commute to the counseling center. It also allows people to see a counselor confidentially rather than risking someone seeing them at the counseling center and telling others they deal with a mental illness. Online counseling has increased in popularity in other countries as counselors realize they can use it to see more clients, supplement their income, and develop new skills. Counselors are doing this within their practices or via companies that facilitate online counseling networks. Virtual reality. Many clients love video chatting with counselors because they are receiving the in-person interaction without commuting to the counseling center. What if there was a way to make this feeling more intense and immersive? Virtual reality is in the early stages of development at the moment, but it could become a valuable tool for counseling once the technology advances. It could allow the counselor and client to feel as if their physical environments have merged. More collaboration between doctors and counselors and other medical and mental health professionals is essential for online counseling. Counseling is typically removed from the experience of seeing a doctor or another professional who helps someone with their health issues. Clients see their counselor in a separate office, and it's rare for a client's counselor and doctor to communicate. This makes little sense because mental health and medical issues are tightly connected. When people experience symptoms such as insomnia and unexplained aches, they often see a doctor without realizing the symptoms could stem from mental health issues. Then the doctor might tell patients they are fine or prescribe medication rather than referring them to a counselor. The medication might help reduce symptoms, but only counseling addresses the underlying issues and provide a long-term solution. Fortunately, many primary care facilities are beginning to integrate mental health professionals. Online counselors work at a primary care clinic, and things further integrating mental health care will benefit patients since it is one of the recent trends of counseling. The majority of people who deal with mental health issues consult a primary care doctor before or instead of seeing a counselor. Integrating counseling by providing funding for mental health professionals to work at primary care facilities could increase access to mental health treatments. In some countries, government is supporting this on a national and state level. For example, Medicaid waiver in the state of Washington that temporarily allows more funds for integration of primary care and behavioral health. Also seen are other events which suggest a trend of integrating mental health care, including the recommendation to screen pregnant women for depression. Focusing more on the relationship and client rather than the symptoms. Online counseling is moving away from the medical model of focusing on symptom reduction and towards the humanistic, client-centered approach. This involves stressing the quality of the relationship between the counselor and the client, which has been an accurate predictor of positive outcomes in counseling. The challenge and opportunity for innovation is measuring the success of this relationship. This is where technology will step in again. If we can all use technology together, we can bring better care, especially to the clients who can make best use of online counseling. Despite the advancement in technology and the desire to build long-standing strategies to effectively deliver appropriate services to clients in the field of counseling psychology, there are inherent challenges that remain controversial to date. Confronting the complexity of electronic media to deliver counseling sessions in the most professional manner is one area that remains a challenge and is expected to continue dominating this comparatively new profession. Moreover, virtual interactions are limited in the sense that the psychotherapist and the client are not connected beyond internet, hence are not able to experience the common advantages that come with physical interactions, such as non-verbal cue interpretations. Issues that have arisen and will continue to generate debate in the foreseeable future are miscommunication, inability to stick to professional code of ethics by some counseling psychologists, inability to access and measure the success of online counseling sessions, and difficulty in keeping internet communications secure. In fact, these issues have been discussed and continue to dominate the profession's sphere of influence. It may be important to state that counseling psychologists may need to participate in developing thoughtful policies and procedures related to technology use in the field of counseling psychology by involving clients in the process. Lastly, it must be important to state that whenever technological intervention affects therapeutic relationship, either positively or negatively, the impact becomes part of the profession, hence must remain in the record.